Are we on? Can you hear me? Can you hear me?
Microphone check.
Lights, cameras.
This is swanky. This is lifestyle. This is culture. Welcome to the social center of everything culture. Culture Daily.
This is a brand new tune, or brand new video, I beg your pardon, coming from the man Jazinho, featuring last mid titled Butter My Bread. Loving that jam, loving that video. Shot by Clarence Peters, I think, if I was right. But anyway, that brings us to exactly 2 minutes past the hour of 9. We're going to 10 a.m. Don't forget, this month is all about sexual health awareness, and we're still deep into the month. I mean, deep into the conversations already, but just at the tip of the month, if you get what I mean. Well, ladies and gentlemen, before we jump deeper into the convo, Cyril, why are you smiling? Because I said we're at the tip of the month, but deep into the conversation. Cyril is already happy and smiling.
Yeah,
yes,
you've thrust us
but we'll
into the
brush
conversation
on the topic gently.
No, I like the fact that you just thrust us into the conversation.
Yes, thrust deeper into the conversation, and but we'll brush on the affairs of the morning.
Y'all be acting like little kids, okay?
Yes.
No, little kids don't know this.
Yes, they do.
But
they do, because the grown adults be teaching
but
them.
the topic to be discussed today will be tackled from behind. Okay.
Yeah.
But before we jump into the conversation, we want to just alert you that we came from the rubber month last month.
Yes.
The plastic month, and this month we are going deeper into sexual
Bro,
health.
I love it.
awareness.
You are really on top.
Oh my goodness, we've been practicing all weekend. Getting ready for today. Okay, you've been waiting for all weekend.
Yes, I'm on top.
You're on top of the issues. That's
Yes.
it. Charlie,
But
go hard.
And no other than the man Dr. Kelvin to give us insights into
I'm sure Dr. Kelvin Grant regrets coming at this point.
insights. We will, no matter how big the topic is, or no matter how small the topic is, we will still take it like that.
Yeah.
Yes. But in all this, don't forget that if it pays to keep it in the family, I'm telling you what I'm going to tell what I'm talking about. ZPay to ZPay. Now send money from one ZPay mobile money wallet to another and get a bonus. Switch to ZPay mobile money and get more and pay less. Receive a bonus every time you send money from ZPay to ZPay, like they say, Jimmy D. Also, at the Kofi Owusu Pepra Live in Tema concert will happen this month, 20th of August. Ministry will be the Lion, Akasi Brimpong, the Soulful Diana Hamilton, and the Evergreen Bethel Revival Choir. They'll all be there. The host is Kofi Pepra himself, backed by the Symphonic Music Orchestra. Tickets are selling fast from 60 Ghana cedis all the way to
Yeah, stop. Guess who's in the building, y'all? Guess who's in the building, y'all? Come on.
Wow. We are very honored. Miss Lenny Lomote just joined us live in the studio. And we're also excited because she took a break for close to 2 months now, and she was due on air this morning. But she just walked into the studio. But anyway, we'll get her in later on.
She's coming.
She's coming. Okay, let's get her in there. Let's say. Lenny, the Ghana is waiting for you. But anyway, while she's on that, tickets are selling for 60 Ghana cedis all the way to 150 Ghana cedis. Very simple. Dial *725 *7000 hash on all networks and buy your tickets. Okay.
I'm happy she came.
Yes, she came.
Yeah.
So quickly.
Oh my God.
Oh no, I think it took a while.
That's good though, right?
I think yeah. That.
We all got excited that she came.
Yes.
Come on, it's always a big
deal.
deal. Will she come or will she not come?
Did it take her a while to come? Or she
I think she came a bit late because the lady did ask that way.
Right, because y'all don't know what y'all doing. That's exactly the reason why she decided to come late.
What are you talking about,
okay?
Candid?
Because y'all were so worried about the journey instead of hitting that
but anyway,
spot.
I'm wondering what took Lenny so long to come.
The journey
to work
was not right. There was too much traffic.
Open for her.
Lenny. Lenny, just say.
Lenny, come again.
Lenny,
come again.
Oh man, we
were excited when you came the first time. Come again.
She here.
Yeah,
she here. Exactly what's going on.
Maybe she'll come later. Let's just keep going.
Her interest.
Bro, let's just keep going. She'll come later.
Yeah, well, keep arousing her interest to come into the studio.
Yeah.
Yeah, to come in the studio. But anyway, visit the flowing tickets outlets to buy your tickets. Okay, the ICGC. I mean, feel like a sinner. The ICGC Zoe Temple, Community 25. Sorry, Community 5, and then that's in Tema. ICGC Evangel Temple, Dowenya Evergreen Supermarket, Bachuna Total, Spintex, and Airport Shell, and Tema Community 11 KFC. You can also call the hotline on 027-142-5442 for the tickets. This is event is sponsored by Total Family Health Organization, DSTV, Silicon Pulse Productions, and all the media partners. I'll tell you about how to win some good monies on 959 mobile, the 590 mobile very soon, as well as smiling good and protecting your teeth and all that and more on the show. But this morning we're going to be talking about HIV, in fact, HIV/AIDS awareness. Okay, we're going to be talking about the risks and the factors involved. But before we do that, we hit the streets and decided to ask people about the fact that do they know that first off there is a testing kit, an HIV testing kit on the market, and would you be bold enough to use it? But let's hear what people have to say before we come back into the studio and get aroused with these conversations to double our interest. Check it out.
I trust myself, so I don't think it's necessary for me. But if you see that maybe there's something wrong of which you don't trust yourself, then I think the best way is to buy and then try it.
Yes, I would suggest it to him, and then if he has the idea, we research and who gets it done and know our status.
So I have to ask my partner if he has heard of it first. So then if he hasn't, maybe we'll research on it so that we can get more education about the test kits then.
But it's definitely something that you will.
Yes, it's very important because in future it might affect our kids. Because I don't want my kids to be stigmatized.
Okay, since I have seen the video about it, so definitely I can demonstrate to her to also try and see. But if it is her wish, then I think I can let her do it. But for me, it is not necessary.
I don't think I think you should test it to know your status or something. So far as you are sexually active, I think you need to test.
Because we don't want to get sick. Normal. I mean, if it be normal, if you are safe there, why it shouldn't be that hard. Let's get tested and we move.
The video where the boys and the girls, if you look them and see there's some boys there and some girls inside there, yeah, Charlie. The question they ask them,
you know what?
They will give political answer.
Nobody said, "Oh, I'm not sexually active."
Yeah. No. The first guy said that he doesn't see. He's been something. He doesn't see the reason why.
My friend.
Oh.
It's very easy.
You know here how the boy.
It's very easy. I don't do some.
Oh, but if you the boy, but you.
Depends, you go do some.
John, good morning. Welcome to the show.
Good morning. The way the excitement is in the house, and I'm hoping that we don't do any premature things. You know.
Really?
No way. Dog, we'll last the whole hour. Solid hour. Back to back.
50 minutes.
Hey, dog, next time we go last.
Cap.
We go last.
Y'all just capping, okay? Y'all talking a lot of big stuff.
It's like you're having post-traumatic stress disorder. What's the issue?
Listen. Y'all just cannot wait for this conversation.
Sister, you have no idea.
The whole month.
You have no idea.
Doc, let me just go a bit into history. We heard it came from animals, HIV.
Well, I mean that's I don't think that has been proven actually. You know, but there is evidence that it can infect some animal species, especially the primates, so monkeys,
bonobo
apes,
monkeys.
You know, so it's possible. However, it will be difficult to prove that indeed it came from the animal population into the human population.
Is it still a threat like it used to be a few years ago? I shouldn't say. Is it still a major threat? Like, you know, you hear someone who's got HIV, it's like you're just going down the trenches.
So let me put it this way. So in Ghana currently, estimated there are about 100,000 people living with HIV who are not aware that they have HIV.
Hi.
So now that's 100,000 people today.
According to the Ghana AIDS Commission.
Exactly.
Right, and the number might not even be right.
The number better be right.
It's probably higher.
Exactly. And I mean, if it's 100,000 people today who are having sex, who are HIV positive, who are not aware that they're HIV positive, what's the number going to be tomorrow?
Doc, wait, so when was this report released?
Oh, it's recent. I mean...
Recent. Is this year?
Is this year?
Hey, then, Charlie... If it were a month ago, then by now, dear.
Yeah.
So now the question is, do you think it's a threat for 100,000 people who are not even aware of their status and they are going out there having unprotected sex? You see, because the natural thing to do, I mean, who has time for condoms, Charlie, to be honest? I mean, when
I do.
No, well.
What you mean? Who got time for condoms?
No, relax. He's not saying don't wear condoms.
He didn't say don't wear condoms.
It's rhetorical.
Yes, it is. So what I mean is, when in the heat of the moment, when you're excited and you want to get into the action, condoms tend to slow you down. So if you think you are
kids,
safe, if you're
kids, that's what it sounds like.
If you think your partner is safe, you are most likely going to go ahead with it. And who knows, he or she might be under the 100,000.
Yes. No, hold on. Kind of, you need to understand that. You see, for a guy fears that the possibility of the girl changing her mind.
Exactly.
Might as well get it while it's hot, huh? Might as well get it done.
No, but that actually sometimes is the fear factor attached to it. But I want to find out if it's the reversal for a girl. If a guy decides to let me go grab a rubber and come, does that in any way change the mood of the female? Because maybe that's what we carry. I don't know.
Yeah. You better come prepared. Because if you're having to go and leave to go get it,
change the mood?
I'm saying
that no. I'm saying that does it change your mood if the guy says I'm going to get a rubber and back?
It does change the mood.
Do you feel like ignored? Because for a guy, the guy feels like, Charlie, he might lose opportunity. Is it the same for a girl?
It changes
I'm asking the wrong
mood.
person.
No, it changes the mood. I think that you should come prepared. If you're gonna have to leave and come back, like, what are we even doing? You should have came prepared. Like, to just get back hot and bothered and stuff like that. Like, right? You're not wanting to put it on because you might lose an opportunity, right?
Yeah.
If you don't have it and you're having to leave and come back, of course you're gonna lose interest.
Yeah.
She's gonna slow down. It's gonna be like, dang, you know what I mean? I'm tired now. I'm gonna go to sleep.
The action must. So anyway, Doc. So it comes back to if it's still a threat.
So it is. In fact, I think it's more of a threat today than it was even yesteryears. You see, because now, to be honest, I mean, even in the Ghanaian society, people are a bit more liberal today than they were previously. So a lot more people are having sex now than in the past. I mean, I talk to a lot of young people, and the number of young people who are sexually active, and I'm talking about teenagers coming into the early adulthood, it's far, far more significant today than it was even when I was in medical school. Because in medical school, you still talk to the teenagers, and it could be that they were having sex, but they were not as open about it as they are today. But
now they're vocal about
it. They are more vocal about it today. And to think that there's a lot of education about condom use, even HIV, STIs.
It's not enough.
People are still more comfortable having unprotected sex than they are using condoms. You see, and in fact, now there are even female condoms out there. But hey, people will still people will still have sex, and then the consequences be damned. So it's a threat today. It's more of a threat today than it was in yesterday.
Regardless the medications that have come in and all.
You see, but how many people are even aware of the medication? You see, and how many people are actually taking the medication consistently? You see, so yes, there's been a lot of interventions. I mean, so from where I sit, HIV is no longer a death threat as it was in the past, because there are people who are living with HIV who have actually lived through their whole life. I mean, 80-year-olds have been HIV positive for the past 50 years. So
without medication?
No, I mean with medication. I'm talking about, with the advances in medication. So it's not necessarily a death threat, but it does not also mean that you should just go ahead and welcome it into your life because hey, there's medication. No, that's not how it works. You still need to prevent, because ultimately there are consequences. I mean, because medication has side effects. So if you can avoid them, all the better. But if you have it, then you can get tested. But here's the issue where I mentioned 100,000. They actually have the infection, but they are not aware. And they are not protecting their partners. So their partners are also getting infected, and they are not aware. So they are also going on to infect their partners, and so on. So now the community,
it's like a million.
The community, they are sharing all the love and all the HIV around.
Can you help us identify the difference in the HIV and then AIDS? That has been something that has been on the minds of a lot of people. We say HIV, AIDS, and we don't know which one is which.
Yeah. So HIV is the virus, or human immune deficiency virus. It's a virus that you get infected with, and for all intents and purposes, it's actually a very weak virus.
Wow.
Yes, it is. In fact, all the infections that are spread through sex are very weak. If you left HIV on the shelf, it would die in seconds. You know, if you left any of the other ones, they would die. That's why they need intimate contact. So you literally have to carry the disease and plant it deep, you know, inside there for
expression.
Exactly. So that's the virus. Now this virus tends to infect your white cells. And that's what makes it difficult to actually treat. Because imagine your military, you know, gets infiltrated. You know, the military is supposed to protect us from attack, but the military is now infiltrated. You know, so the military now is okay. So let me put it this way: when you have, say, malaria, and you are taking malaria medication, the medication goes to augment what the white cells are doing, so that they get the malaria parasite out of your system. You know, but now this is HIV, so the thing that was supposed to protect you is what is actually now killing you. So when you are taking medication, what the medication is supposed to now do? Because the medication by itself cannot do the job. They need the help of the white cells to get the job done. But now these white cells are incapacitated. You know, so eventually, as the virus replicates, replication means they are just dividing and getting and becoming more, you know, bolder. You know, so they start expressing themselves more. Then, because the white cells are now ineffective, other infections start coming in. So we call them the opportunistic infections start coming in. You know, and then at some point when the white cells are pretty much no longer functional, then we say you have AIDS. Because now you have acquired immune deficiency syndrome.
Oh, okay.
So now everything just, you know, like there's no protection, so anything can just knock you down. You know, so that is AIDS. So HIV will eventually result in you developing AIDS. So AIDS is not just one, it's not a disease per se. It's an amalgamation of different disease conditions coming together in one person. You know, so that's what the name implies.
Okay, so
Can I ask a question real quick?
Okay, go ahead.
If you're talking about like cancer, right? There's different levels of cancer to be fatal. Are they the same with AIDS? I know like the HIV and then the AIDS, but is there different levels to it?
So it's progressive. And in fact, HIV does predispose you to certain cancers as well. I mean, the most common one, in fact, the pathognomic one. So there's a particular cancer that if you have, we know you have HIV. It's called Kaposi sarcoma. You know, so if you actually have that cancer, like 99% you have an infection. You have an HIV infection. You know, that nobody probably discovered. So HIV itself can even predispose you to some other cancer. So it is progressive, and depending on which stage it is detected, then I mean it determines the kind of interventions you're going to have. You know, if we catch it, I mean, and it's not as if when you are infected immediately, then you start taking medication. So there's something called CD4 that they will be monitoring over the period. The CD4 is also part of the white cell. In fact, it's a particular white cell that gets infected by the HIV virus or the HI virus, whichever way. You know, and so they will be monitoring this CD4 count, and when it crosses a certain threshold, then they would have to start medication to sort of give you a little boost. You know, so it's
because prior to that, it can sometimes manage.
Well, I mean, when you are infected, that's why it takes about 10 years, first of all. And you know, in the past, that's why it was so difficult to make that connection as to what exactly is causing this AIDS, because people were coming in with AIDS and we didn't know what's happening. They were coming with multiple diseases that, you know, typical. Let's say candidiasis. Candidiasis is a rather common it's a common fungi, yeast infection. Now, for a lot of women, it's actually normal flora. When we say normal flora, it literally lives in the space in the vagina. It doesn't cause problems, but due to certain actions that the women take, we'll talk about that some other time.
Oh, but you can touch on it. You can just touch on it. You can touch it small.
Okay.
So it's in depth.
You can just touch it small.
So I mean, so candidiasis lives in the vagina of a lot of women. It's normal. That's where it lives. You know, but for instance, you know, when our culture, women are taught to clean themselves, so they try to put all sorts of these things, feminine washes, like douches, to try and keep themselves clean. Now this changes the pH, the acidity of the vagina, which then motivates the yeast to actually start proliferating, start growing more. So then you have a condition called candidiasis. So if we did a test and we found candida in your vagina, it doesn't mean you have candidiasis. Candidiasis is when they overgrow. Now, somebody with AIDS can have this candidiasis like so much candidiasis. I mean, it doesn't even make sense. You now start developing it in your mouth, you know, in your eyes, other places, you see. So if you saw something like that, obviously you'd be concerned, you know. So why is this person developing this fulminant candidiasis? And then they started tracing back to, you know, some sexual encounter you had 10 years ago. Because maybe that partner, you know, has also started developing something along the lines. Okay, could that be the connection? So that's how eventually the HIV was eventually isolated. You know, so
they went to go get tested because of that reaction.
Exactly.
10 years later, after 10 years.
Yes.
10 years.
So it takes
Oh my
it takes that
goodness.
long. It takes that long for the HIV to establish AIDS. You see, so it's not something that happens. You have sex today and then you have HIV, you have AIDS tomorrow. It doesn't work like that. It takes a long time. Now, if we catch it early, we can give you medication to delay AIDS or even to prevent from happening at all. You know, so there's still room to get tested and know your status, because if you are positive, there are interventions available. You see,
You might as well find out early.
exactly. The
Don't wait
earlier,
till
the
late.
better.
Yeah.
It's because you, like I said, there are other cancers that could result from HIV. So the fact that maybe you don't develop AIDS does not mean that you are okay. You know, because you could develop some other cancer and die from that cancer. So we don't want you to get there at all. You know, and I mean, thankfully these days we don't even see the emaciated pictures that we're seeing in the past. You know, HIV would give you see the skeleton lying in the bed. No, thankfully we don't see that anymore.
HIV branding.
Yes, but it's still an issue. It's still a big deal. You know, and there's also a phenomenon where people are on antiretrovirals to keep their HIV in check, and they are still having unprotected sex. I mean, I think that's just criminal, to be honest.
Well, I was going to ask you, I've heard people saying that they were undetectable, but they have HIV, but they can have sex because nobody else, like they can't pass it.
Yeah, but you see, to answer that question, let me introduce this thing. Now there are actually two different HIV viruses. So there's HIV-1 and HIV-2.
Okay.
So the fact that you're infected with one, unless you're undetectable, does not give you the license to have unprotected sex, because now you could actually get infected with two.
You can get it.
So yes, there are people who are walking around with HIV-1 and 2. And you see, when it comes to viruses, you know, there's the most recent one, COVID. You remember how the COVID was mutate? It was mutating. So you had the Omicron, you had this and that. It's something that's common with viruses. That's why pretty much every year there's a new flu strain, and you have to go and take a new flu vaccine, because the flu strain is always mutating. Same thing can happen. Now, if you have HIV-1 and HIV-2 in one person, who knows? They could come together and form HIV-3. So we don't want you to the fact that you're undetectable does not mean you can go ahead and be having unprotected sex. It's not fair to the person you're having sex with, you know, because undetectable does not mean that you are cured. Till now, we don't have a cure for HIV. So the fact that you're undetectable, there's still a risk of you infecting somebody, or that person giving you a different infection. You see, so we don't want that at all. And the very things you did that probably most likely got you the HIV infection is what you are doing now, just because you're on treatment. It's not fair. You see.
Okay, let's really understand. This might be maybe an ignorant question, but then just to understand the transmission, for a guy, let's say an infected guy, who's you watch my face like,
and they look for your words, and they wait for the words.
The words, I know. Okay, anyway, a guy is having sex with a girl. The guy is infected. He doesn't necessarily release any bodily fluids into the.
No, but
I want to understand how the transmission.
So, I want to ask you a question. At which point do you start releasing bodily fluids?
Before, way before.
No.
Please.
I don't know. I haven't done some.
I would like to vote that Candid hosts the show.
No, you have kids, so you already know. It's called pre-something, right?
No, the pre-cum.
Right.
So, is that what can be the?
I mean, so the HIV is in all but we've tested all body fluids, right? And thankfully, it's not found in saliva, it's not found in tears. You know, so you know,
that's good.
Yes.
What about sweat?
It's not found in sweat either.
Okay.
So we are very excited about that. Otherwise,
that's good.
Otherwise,
everybody will have it, right?
I kid you not.
Okay.
You know, but any other body fluid is in there. So blood. Semen, and remember, semen does not, or how do I put it? It's a composition. It's made up of so many different things. Now, when a man is having sex, or even a man is aroused, there's a discharge or a lot of people get this, some kind of discharge initially. There's a theory about how the initial sort of discharge is meant to cleanse the tubes. Because for a man, you pee from the same tube, so you cannot just be having sex and putting urine in the woman. So it's important that it sort of cleanses the tube, and then the main action will now start. So there's body fluid coming out pretty much all through the sex act. So you cannot say that if I don't ejaculate, I'm not going to get HIV. And again, for the woman, once the woman is aroused, she starts secreting body fluids. And all those fluids have HIV in there. So again, you cannot say that the only time you get infected is when semen is released. So you wear condom. And at this point, let me also chip in that a woman, the risk of a woman catching HIV from a man is far, far higher than a man catching HIV from a woman. And this is because of the whole physiology of sex. Yes, the whole act of sex puts the woman at a disadvantage. And so if you're a woman, you really, really, really need to insist on the condom.
Period.
I mean, it's actually, it should be, I mean, I know I might sound sexist, but it should be the woman's responsibility to make sure that the sex is safe, to be honest, because the sex act is traumatizing to the woman's vagina, because, I mean, Charlie, all the up and down.
The sex act is traumatizing to the woman's vagina. Have you heard pounders, womb shifters?
I beg you, have you not heard the people hada? They don't know that they are traumatized.
You always have got a out.
I beg you. This early morning they should shut up ground.
But you see, I said traumatized. I didn't say the trauma is anti-pleasure.
Yes, no, it's unwelcome.
This is pretty much welcome trauma. But from a medical perspective, I mean, if you were to, and all these studies have been done. Human beings have been studied for a long time. If you actually took a microscope and you examine the vagina after sex, you'd actually notice bruising. Bruising in the walls of the vagina.
Oh, can it?
Of course. Listen, we don't mess with small boys out here, okay? Okay?
Razak.
Listen, some people need a break, okay?
Now, when there's bruising, or even bruising literally means that, so the area is inflamed, and once there's inflammation, the white cells are alerted, hey, somebody is attacking my borders, so I need to go there and protect the place. And once they go there to try and protect the place, HIV is waiting. In fact, that is what HIV is waiting for. So once the white cells get there, oh, Charlie, my transport is here. Then they jump, they cross into the white cells, and that's it. So then, that puts the woman at a higher risk. You see, because in the sex act, the man is giving and the woman is receiving. On the flip side is that
right now some women are even giving. Some women are giving. Olele.
Olele has been missing. We've done 29 minutes. I've not heard Olele.
Olele, they've been giving you, eh?
Olele, everything okay?
Have you been receiving?
Doc is teaching.
And related to that, today, the highest at risk population is actually men who sleep with other men. They are the highest at risk group of people. You see, because there are now two problems or two issues at play. The first issue is that they are having sex in through an area that is not
unconventional.
Unconventional, not accustomed. Not accustomed to that act.
Biologically predisposed.
So because of that, it means that the risk of transmission is higher. You see, again, the vagina was created for that purpose. So in as much as the sex act puts the vagina at risk, it is not so bad when you compare to the anus, which was not made for that at all. So that's on that side, the slightest trauma, more white cells come there, and then the transmission is far higher. So men sleeping with men are the highest at risk group of people, and then followed by obviously women engaging in anal sex, or any other sex apart from penile-vaginal sex. So these are some of the risk factors that you really need to be mindful of. And so I engage people, and they when they are having vaginal sex, they use condom. And when they are switching to anal sex, they don't use condom because hey, that one the place is already exactly, you can't get pregnant. But that is actually the higher risk of infection. You see, so whatever sex you are trying to do, protect yourself. I mean, it cannot be overemphasized.
If it doesn't live in saliva and you engage in oral sex in an infected man, can a woman then get it?
So,
or it's maybe 50-50.
You see, this is why, I mean,
or maybe it's harmless in the mouth, but it can be present.
Hold on.
Okay.
So here's the thing. If you are having oral sex with an infected person and there happens to be a cut,
okay,
in your mouth,
and you see, it's so easy to get the cut in your mouth. There are people who literally bleed every time they brush their teeth. You know, because you haven't been to the dentist this whole year, so there's plaque that has built up and it's eating into your gum. So there's already an opening there. You may not even
the plaque comes off. There is
exactly. So now you are having oral sex with an infected person. That's an inlet right there. So even though the virus the virus presence in saliva is negligible, it does not mean that you cannot catch the infection through your mouth. You can still catch it in your mouth, especially if, for instance, the man ejaculates into your mouth. You could catch the infection if there's a cut in your mouth. Or when you're going down to the woman has a cut down there. You don't know. You go and take it. You take everything in, and then you also have a cut in there. You know. Or let's project a bit. Let's say you have an ulcer. An ulcer in your stomach, and then as you're doing the thing and you are swallowing. The ulcer is a cut. Ulcer is a cut in the lining of the stomach. It could get. I mean, just protect yourself. Get tested. Know your status. If you have to take antiretrovirals, take antiretrovirals. So in that case, this is where if you tell me that the person is undetectable and so you are having oral sex, I mean, that is a bit more. It's excusable, than to say that because I'm undetectable, I'm not going to use a condom on a random stranger. It doesn't make sense.
Look, let's talk about the progressive nature of the disease, where it starts from, and the very. I know somebody can walk into a hospital with malaria and a fever, a flu, and as it goes. But what are the very common stages of HIV before it develops into AIDS?
So that's one of the most difficult areas as well. That's why again we preach testing. And if depending on how risky a lifestyle you are living, you are supposed to be testing every 3 months, every so often. And let me also just chip in that if you did a test today and it was negative, you'd have to repeat in about 6 months' time to confirm that test was actually true. You see, but if within the 6 months you are still engaging in a risky lifestyle, then if you do that 6 months, you have to do again another 6 months' time to confirm. You see, so that's the thing, because that's about how long it takes for the HIV to be detectable in blood. So the challenge though is that the initial symptoms are so non-specific. I mean, just like any other viral infection, it could just be some fever, weak tiredness, loss of appetite, headache.
Sound like malaria.
Exactly. So the initial symptoms are so non-specific. Yeah, I mean, nobody even would suggest HIV. I mean, if you came to me with a headache, fever, why would I even go and do HIV test? So that's how difficult it is to tell you that if you have this and this, go and test for HIV. No, rather the focus is if you have been engaging in unprotected sex, particularly with multiple partners, or with one partner who happens to have multiple partners, you need to go and get screened. It's a screening that will detect or will pick up any HIV that is probably there, But in terms of symptoms, it's so non-specific.
When does a doctor then or a medical practitioner then want to check for HIV?
Okay, so I mentioned the Kaposi sarcoma. If somebody came with Kaposi sarcoma right now, HIV will be high on the agenda, so you'd have to go and get tested. If somebody comes in with multiple repeated infections, I mentioned candidiasis, for instance. Anybody coming in with candidiasis multiple times, and you've counseled the person to stop douching, and the person has actually stopped douching. You've checked diabetes, because that's also one of the predisposing factors, and the person is not diabetic, but the person still keeps coming back with candidiasis despite adequate treatment. You'd want to check for the immune status of that person. If the person has HIV, so that you can rule it out alongside other. So if someone is having recurrent infections, that it doesn't make sense, because the person is getting proper treatment. This is not half treatment, proper treatment, but it's still not working. You want to look out for that. And then there are these, we call them opportunistic infections. So candidiasis is actually one of them. Then TB is another. I mean, typically you don't see people with TB that much these days. But and so if anybody comes in with TB today, you want to screen for HIV, because could it be that the person has HIV and that is why the TB has really said? Because the truth of the matter is that a lot of us, especially those in our age group who grew up in that time of Ghana when it was harder, we have been exposed to TB at some point, but we don't have TB. So now if that TB should reactivate at this point in your adult life,
there's a weakness somewhere.
Exactly. So we need to go and look for what is causing that weakness. So several other similar disease conditions. If you came to me today with one STI, maybe gonorrhea or syphilis, I would have to check for HIV, because they move together. Wow. So if you have had an STI before, your risk of HIV is also high. So we need to look out for HIV to make sure that it's not hiding in the background.
Oh well, so some more questions coming in here. Let me ask with regards
before then.
Okay.
So same thing. So somebody comes with hepatitis B, hepatitis C, because all those so the STIs, we have gonorrhea, syphilis, hep B, hep C. What else? Yes, these are the main ones. So anybody coming with those infections, you want to check for HIV as well.
Okay, doctor, let's move to one of the mythical areas of this transfer, which is salons. And tattoos.
I was going to ask
for persons in the creative art space, tattoos is one of the most beautiful things. In this room alone, we have, Karen has got tattoos, producer has got tattoos. People love tattoos. Lenny, who just came after a long break, who just came, has tattoos. There are myths around needles and all that we've heard. When HIV was a big conversation a few years ago, when Ghana's commission had to put out so many communiques around HIV, we saw the ABC and all those things. Abstain, B was something. Be faithful, and C was condom use. All those brilliant campaigns that came about. It was because they were now identifying, how ruthless this virus was.
You can wait until my rage.
And then the conversations about the salons, be careful about your blades and all that came in. How possible is it, in this day and age? Like, because cutting of hair, Cyril had a lot of hair, and then recently he went to cut his hair. So maybe, are we saying that maybe Cyril, maybe...
I remember the very first time I did an HIV test, and, this was medical school, like it was 5th year. And we had a session about HIV, and everybody was asked to go and run an HIV test. And I'm sure that the attendants were teasing. So when I got in, and they're like, so where do you cut your hair? I'm like, oh, around the corner. Do you take your own blade? Hey. Asamaba. No, I don't take my own. Do you take your own clipper? Hey, master, now what are you trying to do here? But yeah, so that's just to tell you that it's actually real. So it happens. It may not happen. It may not be as a big a deal now as it was then, because most, I wouldn't say all, but at least most barbers would use a fresh blade for every person who goes in. But you still have to be careful. You still have to monitor, because you don't want somebody to pull a fast one on you. But it's possible. If somebody was to cut their hair right, and all of us who cut our hair, when you do that spirit, you can tell that there were some cuts, even though you didn't even feel it during the. I don't think anybody would actually draw blood when they are shaving. But once they start applying the spirit, you can tell that there were cuts. So if indeed that cut is there, and then the next person comes in immediately and they use the same blade on that person, there is a risk that it could be transferred from that person to another person. Tattoos especially would put you at risk, and that's why, even though I personally disagree with this, but in Ghana, if you have a tattoo, they don't let you do blood donation. I disagree, because elsewhere they allow you to do it after a window period. I think the window period is about 6 months, because that is when I mentioned earlier, that's how long it takes for the HIV to actually show up in the blood. So that it tells you automatically that it's a risk. So if you are going to get a tattoo done, you don't just get up and do it any corner shop. There needs to be proper sterilization gear. I'm sure that definitely. I wish I could stand the pain for a tattoo, but Charlie, I don't know. However, it's cutting into your skin, and once it's cutting into your skin, if you have HIV, that needle or that blade is infected. And if they were to use that same blade on the next person, especially within once you get off the seat, another person comes, you could get infected. So if we hear stories about the people making blood bonds and blood packs, cut here, you see it in the movies.
Yeah.
It's not something that we should do, because if that person has HIV and you go and do that thing, automatically that's direct route into your blood. So you don't want to do that at all. So yes, it's not a myth, it's real. You can get infected if you share cutting or piercing tools. You can't get infected.
Then the clippers there, we should be afraid of, because the clippers, you see, if they finish next, then you come and sit down and then we move.
No, but they put it in a sterilizer, right?
But yeah, I want to come and talk about that sterilizer and how long it's supposed to work. If those UV rays are really killing, whatever.
And that's if it actually works.
The ultraviolet
rays. I don't have the answers, but the questions I'll ask is: are they really ultraviolet? Because blue light doesn't mean it's ultraviolet.
Yes,
it could just be they wrap blue sellotape around the thing and it's giving you blue vibes.
Some of those things are sold in Accra.
You see,
so ideally, just go with your clipper.
Ideally, you should go with your clipper. But the interesting thing is that even if you went with your clipper, most the clippers there are different clippers for different purposes. So even if you carry one big clipper,
they still go take one shape.
Charlie, it's not easy.
Because I took my clippers and most of the time they tell me, Charlie, your own
some way,
yeah. It just reminds me. If I go my next question, it just reminds me of one of my experience when I went to do an HIV test, and then so first off, I entered the lab. The receptionist was watching me like, I've made you out. I don't want to mention your name, so she's please, what's your name? I write my name down, and then the lab technician. So he comes to do the lab technician does the test. J Foley, eh? Yes. I didn't watch you. Okay, cool. We finished that conversation. And I come inside the reception. I'm waiting for the results. I'm sitting down there. After about 20 minutes or so, then the lab technician comes out of the lab.
But why did you do that?
Then he goes to sit down. He goes to drink water and comes to sit down, and then he goes.
Why are they so dramatic?
After 5 minutes, because he brought the results.
No, it's true. Actually, after 5 minutes,
he brought the results to the receptionist, right? And then the receptionist is now also staring at me this way. Mr. Foley, please, is ready. Why?
Why do you make
Even if you don't have anything in your mind, that doesn't mean it's scary.
People
have you ever tried to teach yourself to breathe?
No, I think HIV test is one of the most scary. Even if you haven't done anything, because
exactly
once they start taking you to the counseling process and they start asking you some of the questions, and you're like, hey, this haircut matter.
Yeah.
So I was sitting there asking myself, so me cry, why I not just find girls then start to do things? If haircut is not going to give me HIV, then why?
What do you do immediately you find out that you're positive after a home kit test?
Well, now, so here's the thing. The rapid test kits, they have an error margin. Okay. So we use the rapid test kits for screening purposes. So if I had to go and screen 200 people,
I don't have
time to do a full test, put in the PCR. No, I don't have all that time. So I'll do a rapid test, And so then the results will come, 5 minutes, the result is in. So we know you are negative, positive. Like I said, there is an error margin. Most of the time, the error margin is on the negative, on the positive side. So they err on the side of caution. That if there's a slight hint of positivity, let's make it positive. Then from there, the testing person or the testing people would counsel you on what to do. So the best thing would be to go in for a formal HIV test.
Okay.
At a proper lab. And even then, if you went to a lab, let's say, any of the major labs, and they got a positive, there is even a third level of testing, which is called, so if you've heard Kolebu reference lab, so you have to actually go to the reference lab for the highest level of testing to confirm that indeed this is positive. But of course, you can't just walk in. So typically, if you were to now go into the HIV clinic, they would have some nice names for it, not necessarily called HIV clinic, where the doctor is now going to attend to you. They would usually request a third level of testing to be clear that this is truly HIV that we are dealing with, because, and they are doing this because, one, HIV it is life changing. it has implications for even the children you are going to give birth to, because you cannot just go through pregnancy like the normal people do, because you have HIV, which puts the baby at risk. You can transmit HIV from mother to child. We want to prevent that, so that's why all antenatal patients go through HIV.
You can or you will.
It's not a will, because now there are interventions.
Okay.
So if you don't follow those interventions, then you will transmit to the unborn child, particularly during the labor process, and also during breastfeeding, because HIV is transmitted through breast milk. So if you are doing foreplay with an HIV partner, and then you take breast milk, you could be putting yourself at risk if there's a cut in your mouth again.
Also in your stomach, which you don't know.
You don't know. So it's possible, So
wrap it up.
All HIV.
Did you hear what the man said? He said foreplay, if you put breast in your mouth and it happens to leak into your mouth, into your stomach, there's no wrapping up of that. So the long and short is that leave breast alone.
Is that possible?
Is that possible, Dr. Asquel?
I think you use saran wrap. Can you use saran wrap?
What? What am I doing? Am I baking?
What?
Do babies? Do grown men actually get something out of the breast milk or out of the breast as compared to the babies?
But this is your question, is it?
But doctor is not privy to our sucking techniques. Doctor doesn't know everybody's sucking techniques. Somebody.
I'm asking a very genuine question. Doc says,
keep quiet. Breast come up now. Get genuine question. Ask your question. Ask your question.
Because I realize that you guys are not asking the question.
Yes.
I want to ask on your behalf.
No, I know you are breast to this
Quiet for 47 minutes.
Yes, you say. So
get it off your chest, bro.
You say that if you are doing foreplay and you happen to
accidentally take left,
you happen to drink water break.
Yes.
That can also expose you to some things, right?
Yes.
But I want to find out from you. Me, I don't know.
Can we put the camera on Olele?
I don't know.
I don't know why
Olele doesn't get close up.
I want to find out.
Please, let's get Olele's close up.
If you are not a nursing mother, you don't produce milk, no?
True.
So, if the person you are doing the foreplay with is not a nursing mother,
that's not always true. Sometimes when the women's hormones are off, some of them
they produce this thing.
Yes.
So something comes out?
Yeah, the pituitary.
I've never had that experience.
You see.
And I don't have
It's possible.
You see what I'm talking about.
So where is the without me giving birth, I can still.
When your hormones are off.
So where is the exposure coming from? Is it coming from maybe
blood.
A cut on the areola, or is coming from?
No, the breast milk itself.
The breast milk itself.
It's
so the woman is not producing breast milk during the process. You are okay.
Yes, technically, except there's another form of discharge coming.
What is the discharge?
Well, I mean. Well, breast milk it's also it's a kind of discharge.
Yes, after I have a child.
That's a normal.
That's the ideal situation.
Exactly. But there are situations or conditions where a woman can lactate even though she hasn't given birth to a child.
Yes.
These are rare, right?
It's not rare.
It's not rare.
It has to do with a particular hormone called prolactin.
Yes.
And prolactin, it's like you mentioned, from the pituitary, it can stimulate certain things. And if you're a woman and you are lactating without breastfeeding, you need to get evaluated so that we see what's going on. It could be something. It could just be one of those things. It's not everything that we can really explain, but it could also be because of a dysfunction in the pituitary gland, or something is going on that needs attention.
So if you're a guy, you are doing that thing and you taste something small.
Oh my goodness!
I mean, so for instance, if you are doing a breast examination, right, part of the process requires you to express milk. Because the woman may not even be aware that there's a discharge. So as part of the examination, so the breast examination is not complete if you haven't, expressed milk from the areola.
Oh, I'm talking about at the hospital.
At the hospital, yes, I'm talking about the hospital, not in the bedroom. Because some women may not even be aware, and so if you do that, and also having said that, if the discharge is from both nipples, generally it's okay. It's not a problem with the breast. It's a higher up problem. When I say it's okay, I mean the breast is fine, but the problem is probably higher up. But if the discharge is from only one breast, then it's possible that breast has an issue. So I mean, if you're a woman, you should be checking some of these things to be on the safe side.
Still on that subject.
But having said that, men can also get discharge from their nipples as well for the same reason, the same prolactin matter. So yeah, it doesn't only happen to women.
Well, then you are in shock.
Only that men will come to the hospital earlier because prolactin actually inhibits sexual performance. So men will come earlier because they are struggling with
No, Doc, wait, hold on. When you
performance.
say men can also discharge from their breasts,
Yes,
right? From
because
their
the prolactin does the same thing.
Is
in
it
men as
is it men who are obese
Only.
or slim men like Jay Foley? Jay Foley doesn't clearly he has a flat chest.
Oh, what does this man have a flat
Yes.
chest? Say you
So
cannot
I
see my-
mean,
I have
you
I
cannot.
have breasts.
Okay,
You have no meat there.
Yeah, that's what I'm saying.
None.
I'm saying.
Yeah, but the fact that he has no meat there, I mean, doesn't mean that the potential is not there.
Okay.
You see, the difference between the male breast and the female breast is that the female breast has, I mean, the female breast is the fully developed breast. The male breast didn't fully develop.
Right.
But the potential is still there. So if prolactin levels were to go up, it could.
But the potential is not as high as like my cameraman fake, who is like, he's thick. He's thick, in
He got a
that
big
area, right? Anyways, Doc, let me ask another question about the use of sex toys.
Yes.
Right. These days, a lot of
young ladies.
I didn't want to even go there. But sexual freedom and sexual independence have been on an all-time high. People are saying they're not responsible for this, not responsible for that. So the use of sex toys have been on a high. I mean, when you go on the internet, you see a lot of people selling all sort of sex toys and whatnot. What about that, and how do they also create that exposure to this conversation?
I mean, it's the same thing. Once you are sharing intimate objects, your risk goes up. So I'm using sharing intimate objects to be all encompassing.
Right.
So if you are sharing the same partner, your risk goes up. If you are sharing the toys, the risk goes up. If you are sharing the needles, the risk goes up. So anything that has intimate contact.
No, I'm sorry. When you say share, like people actually say, "Charlie, use Biana."
No,
that's what people actually do that.
But people are doing threesomes and fours. Isn't that sharing the partners? You see, because here's the thing. Now, I mean,
because I thought these things are about personally.
It's not even about sex toys for ladies. Guys also have got dummy vaginas.
No,
I don't know if you have one. The one I buy for you, did. Okay, all right, cool.
I nickname myself.
The reason I'm asking this is because I maybe I'm ignorant, but I can't imagine someone buying a sex toy for themselves, right? And then
I'm talking about women or guys.
Women.
Oh, sister.
Women.
No, but
and
who do you think is buying it? Sex toy business is $1 billion.
Yes, but I'm saying that.
No, but he's about sharing it with other.
Let me borrow your dildo.
Exactly.
No. I don't think anybody.
That's not true.
No, I think it's.
You share yours.
I don't.
So you have one.
I ain't sharing that with nobody but me.
No, but let me make my sharing. Yeah, I just wanted to.
Kids.
No, leave Candid alone. I just wanted to say
to
that.
Bring it to work tomorrow.
Like Jay Foley said. Like Doc said. It's okay. People are having threesomes and foursomes and orgies and all these things. But what I wanted to say is that with those things, right, there's an added sexuality to it. A threesome is intriguing mentally. It's totally different from let me borrow your dildo. Do you understand what I'm saying?
But Doc is saying people are still sharing.
I'm talking about the frequency.
Okay.
It's more likely.
It's not about the free. Okay, well, you mean frequency in general?
In general,
okay.
It's more likely to find people who are willing to do threesomes or go to a sex party than it is to find people who are willing to lend out their private sex toys.
But the same psychology behind the threesome. Oh, this guy. Let's share this guy. It's the same way that let's share this dildo. I mean, there's some. I haven't been there, so I can't really speak from
which
experience.
one, the dildo or the?
All I know is that it's happening, and once you use a dildo and there's sexual discharge all around it, and somebody else uses that same thing. If one person has the infection, you can transmit it to the next person. So everybody should just keep to their own dildo. That's all.
Keep to your own dildo.
I know, right? My last question is on.
Tomorrow we'll have the same conversation.
Yeah. My last question is on declaration of status, and if you are on the antiretroviral drugs, because it is said that you will not transmit if you are on the medication. First of all, is that true? And then would it be, if you don't transmit, must you declare it?
So I mean, here's the thing. I'm not too clear on this particular point, but I think there's actually there's been an amendment to the law which actually makes it criminal to not to intentionally infect a partner. You know, but I need to get clarification. I'm sure maybe some of the viewers might have more information about that. You know, the fact that you are I mean, if this is why, for instance, the churches, even though sometimes they may overdo it, but this is why they would insist on doing some of these tests before marriage. You know, before making your union official. I mean, sometimes the official night has been the union has been official for a while. You know, the fact that first of all, the fact that you're taking medication does not mean you can't transmit. It is when your levels are suppressed to a certain level, then we say you're undetectable. Then your risk of transmission is minimal. Having said that, if you were to miss a couple of doses, which is very, very typical of people who are on chronic medication, it happens in hypertensive, it happens in diabetic. You know, if everybody was taking their medication, I'll probably be out of a job. You know, but it doesn't happen like that. People would be on the medication for 2-3 months. I'm tired. They will go off for like 2 months and then come in with an emergency. You know, then you have to intervene. So if you are taking antiretrovirals and you stop taking it for 2-3 weeks, that undetectable level suddenly becomes detectable, and then you can infect your partner. So now, if your partner is aware that you are on antiretrovirals, guess who is going to be policing your taking of that antiretroviral? Exactly.
But Doc, how long do what's the duration for these drug intake?
No, this is for life.
For life.
For life, because the infection is for life, pretty much. As we are speaking now, there's no cure for HIV.
Right.
You know, so you are going to be on it for life.
For life.
And so you cannot decide to stop. You know. Now, if you are female, for instance, and you stop because I mentioned that there's usually some cutoff before you even start the medication. Once you get pregnant, you actually will be on medication regardless of your CD4 count level, because now there's another person at play, and if you don't do that, you could end up infecting that baby. You know, and so declaring your status to your partner is a must. You know, you have to declare your status to your partner. If that partner but let me just say that currently there are a lot of discordant couples. What I mean is the man is positive and the woman is negative, and they've gone on to marry and they've had children who are negative. Same way, there are women who are positive who are married to men who are negative, and they've gone on to have children who are negative. You know, so having HIV is not the end of the world, but there are things that you need to do, and the psychological effect of HIV is heavy. So if you are going around carrying that burden alone, you know, it's not easy. you need support. And the best person to support you, obviously, is the one who has a stake in whether you are taking the HIV or not. But in all this discussion, there's also something we call pre-exposure prophylaxis, which is something that we offer to health workers, sex workers, people who are rape victims, you know, people who have been inadvertently exposed to HIV through no fault of theirs, even if it's through their fault. I mean, hey, once there's an exposure, there's a time window that we can actually prevent the virus from establishing an infection, you know. And so if for any reason you feel you have been exposed to somebody who has HIV, or particularly the rape victims, obviously the person who raped you will not be standing there for you to go and do a test. Right. So anybody who is raped, we actually have, I think we have within 72 hours to initiate.
I learned about this thing the hard way at the dentist.
Okay.
I was having a tooth extraction and they were having a problem drilling it, and then I think a bit of the tooth cut through the
gum.
No, cut through the gloves and cut the. The
dentist.
So I was asleep and hearing, and then the hearing stopped. And when I opened my eye, everybody was scattering left and right. And then they came to draw my blood, draw the doctor's blood, and paused everything. And then 30 minutes later, they came and said that we are fine, we should carry on.
Wow.
But they brought the
prophylaxis.
They were on standby so that in case.
Okay, so but before all that, let's say for instance that he went. Okay, I want to know if I wanted to protect myself. Just like I would use a condom, I'm gonna, is there anything I could take to really?
So the best still remains the condom. If it's a one night stand or a partner you don't trust, even if it's a partner you trust and you don't know whether he or she has other partners, the best is to use a condom. Condom, because even if you took the prophylaxis for HIV, remember there's hepatitis B, there's syphilis, there's gonorrhea, there are other things. So
but dog, the condom to break so.
Well, that one is true.
And then no, just to quickly time.
But the breaking of condoms there, unless you are intentional Razak, because on this day and age, what did you do with the condom?
I want to find out if you can wear double rubber.
No, double rubber will actually break faster than a single rubber because of friction. So
and it'll get lost.
Doc, please, that question I want to answer it, please.
Before you answer,
why are we doing it? Let's shake hands and go out.
Unless this is a pinhole, because why will you wear two?
Yeah, let me quickly ask this.
Extra protection.
Just about 2 weeks ago, they rolled out self-test, HIV self-test kits for anybody who wants to. And I think we talked about it, saying that it's a good idea, but it also means that it's going to increase the chances of people being reckless. What do you make of it as a doctor? I mean, from
you waited to the ending. Now your energy has come for the thing.
You answered this for us.
I mean,
I left it for the best.
It's true. I get you, and that's why I made a point earlier that if you did a test today and it was negative, you'd have to repeat that test in 6 months' time to confirm that what you had done 6 months ago was indeed negative, because it can take that long. So the fact that you and your partner want to have unprotected sex, so you go and buy the kit and you test and both of you are negative, so you go ahead.
Fire!
In 6 months' time, if that partner tests and it becomes positive, it means that it was actually positive at that time,
the result
but it just didn't show in the test.
There's so much time in between.
Yes.
That's so much time. They're just passing around the package.
So that's why just wear the condom, to be honest. Just wear the condom.
Did you know that there are styles that can prevent this thing?
Tell me, doctor.
Come to my
clinic.
Where we teach you all the
We'll have to go check it out.
Thank you so very much for joining us this morning. It's been very insightful, understanding, why we have to protect ourselves. But every time we eat, food and sugars are trapped between our teeth. The only way, please, HIV does not get trapped between your teeth. For those people who want to connect, HIV cannot get trapped between your teeth, but food and sugars can, okay? And you need to brush your teeth day and night with Pepsodent Cavity Fighter, because it has pro-fluoride and microcalcium ingredients that will help seal tiny invisible holes in your teeth, all right? It's very effective. Also, you can play the 590 mobile game easy just by dialing *959#, and then you can play the game Monday to Sunday. There are different games you can play on there. And when you chop your money, please chop it big. Stake responsibly. Don't for persons below the ages of 18 years. Try Bang & Olufsen as well. Lovely products on the high-end electronic gadgets. Drew-worthy gadgets. You can check it out. Home theater, speakers, headphones, TV sets, soundbar products, all released day in, day out. You can go and check it out. Bang & Olufsen like no one else. On that note, our time is up. We have to go. It's been an insightful HIV conversation this morning. It's our Sexual Health Awareness Month. This month we're talking a lot about sex,
as well as HIV Awareness Month.
Yes. Go out there and be safe. Go out there and be safe. Yeah. Do more, but be careful. Do less and be careful more. Yeah. On that note,
bye.
We have to go. Olile, so you go do
bye.
Okay. Bye. Doc, before we go, in a moist environment like club, sweating, breathing, people, anything like that can
Not in that kind of environment. Except as you are dancing, somebody is doing things in the dark. That one there, I can't tell. But if it's just the dance and the sweat, there you are safe.
Since we are finished, you off the thing. Let me go and get a towel.
Okay. No, our time is up. See you tomorrow.